Hello, everyone. Today we'll be discussing ethical issues in occupational therapy. Our presentation focuses on promoting ethical practice and professional responsibility within occupational therapy. Throughout this presentation, we'll examine common ethical challenges occupational therapy practitioners face and discuss strategies that support ethical, client centered care. Key ethical topics. Ethics influence everyday decisions occupational therapy practitioners make. Today, we'll discuss several important ethical topics, including client autonomy, confidentiality, cultural competence, professional boundaries, resource allocation, and conflicts of interest. By understanding these issues, therapists can make informed decisions that promote clients while maintaining professional integrity. Why do ethical issues matter? Ethics serve as the foundation of occupational therapy practice because they guide our professional judgment and interactions with clients. Ethical decision making promotes safety, dignity, trust, and equitable care. According to the occupational therapy manager, ethical leadership and professional accountability are essential components of quality occupational therapy services and effective healthcare delivery. What are ethics in occupational therapy? Ethics are the moral principle that guide our professional behavior and decision making. The AOTA Code of Ethics is based on six core principles: beneficence, non maleficence, autonomy, justice, veracity, and fidelity. Together, these principles help occupational therapy practitioners provide safe, honest, respectful, and client centered care while maintaining public trust in the profession. Common ethical issues in OT. Occupational therapists encounter ethical concerns in many practice settings. These may include respecting client autonomy, protecting confidentiality, providing culturally responsive care, maintaining professional boundaries, managing limited resources, and avoiding conflicts of interest. Many ethical dilemmas require balancing clients' needs with organizational policies, insurance requirements, and professional responsibility. One of the most important ethical principles is respecting client autonomy. Clients have the right to make informed decisions about their care, even when they choose not to follow our recommendations. For example, a client may decline the use of an adaptive device because they feel it limits their independence. Our responsibility is to educate the client, explain the risks and the benefits, support informed decision making, and ultimately respect their choices. Occupational therapists regularly handle confidential health information. Protecting client privacy is both an ethical and legal responsibility. This includes following HIPAA regulations, securing documentation, avoiding discussions about clients in public settings, and being cautious when using social media. Maintaining confidentiality strengthens trust between therapists and clients. Providing culturally responsive care is another essential ethical responsibility. Occupational therapists must recognize and respect each client's cultural beliefs, values, traditions, and communication preferences. Practicing cultural humility, avoiding assumptions, and adapting interventions to meet individual needs helps ensure equitable and effective care for diverse populations. Professional boundaries help maintain therapeutic relationships while protecting both clients and practitioners. Therapists should avoid dual relationships, accepting expensive gifts, or becoming personally involved with clients outside of therapy. Maintaining appropriate boundaries preserves professionalism, protects therapeutic integrity, and supports ethical practice. Occupational therapists often face difficult decisions when resources are limited. Insurance restrictions, staffing shortages, and productivity expectations may affect the amount of therapy clients receive. At the same time, therapists must avoid conflicts of interest by ensuring that personal or financial influences never interfere with professional judgment. Ethical practice requires balancing organizational demands with client centered care while remaining committed to fairness and professional responsibility. When faced with an ethical dilemma, occupational therapists should follow a structured decision making process. First, identify the ethical issue. Next, determine which ethical principles are involved. Consider the client's wishes. Consult the AOTA Code of Ethics, and choose the action that best supports client centered care. Using a consistent framework promotes responsible and ethical decision making. Ethical practice benefits not only individual clients, but also the profession as a whole. By maintaining high ethical standards, occupational therapists strengthen public trust, promote accountability, support equitable healthcare delivery, and improve client outcomes. Ethical leadership also contributes to healthier workplace environments and better decision making across healthcare organizations. Moving forward, why it matters. Looking ahead, continued advocacy and education are essential for strengthening ethical practice in occupational therapy. Future efforts may include ethics workshops for occupational therapy students, discussions during fieldwork preparation, continuing education opportunities for practicing clinicians, and the development of additional ethical decision making resources. Ultimately, ethics guide every aspect of occupational therapy practice. Our decisions affect clients, practitioners, healthcare organizations, and the profession itself. By maintaining professional integrity and advocating for ethical healthcare systems, occupational therapists can provide safe, effective, and client centered care while continuing to advance the profession. The information presented today is supported by resources from the American Occupational Therapy Association and the Occupational Therapy Manager, 6th edition. These resource references provide current guidance on ethical practice, professional responsibility, and leadership in occupational therapy. Thank you for your time and attention. We appreciate the opportunity to present on ethical issues in occupational therapy.